All right, today we're going to pull back the curtain on a treatment that for so many people is an absolute lifeline, IVIG therapy. We're going to talk about what it really means to, in essence, borrow a healthy immune system and how the whole thing works. Does this sound familiar? You know the drill, right? That constant cycle of sinus infections, bronchitis, maybe even serious stuff like pneumonia. It forces you to be on antibiotics all the time and just puts your life on hold. It's exhausting, and it's so frustrating for anyone with a compromised immune system. But what if you could call in the cavalry? What if you could literally borrow the defenses your body is struggling to make on its own? Well, for a growing number of people, that's not science fiction. It's a therapy that hands you a ready-made army of antibodies, ready to fight back. Okay, so to really wrap our heads around this, we first have to understand the why, right? Why would your body, which is designed to be this amazing fortress, suddenly need help from the outside? Let's take a look at what leads a doctor to recommend this kind of support. Well, it usually boils down to a few key things your doctor is looking for. The biggest one is having consistently low antibody levels. That's a mouthful called hypogammaglobulinemia, which is what leads to those awful repeating infections. Other signs could be that vaccines just aren't giving you protection, or maybe your immune system has been weakened by other necessary treatments. And this is a perfect example of how that can happen. In a condition like Waldenstrom's macroglobulinemia, the body gets stuck making tons of one type of antibody, and it kind of crowds out the factory floor. So your body can't make the other important ones, especially IgG, which is your main defender against bacteria and viruses. With a huge chunk of these patients having low IgG, their risk of infection just skyrockets. All right, so we've got the problem down. Now let's talk about the solution, IVIG therapy. And the big idea here, it's all about collective strength, borrowed from thousands and thousands of generous donors. So what in the world is IVIG? The name sounds super complicated, but the idea is actually pretty simple. Intravenous, that just means it goes into a vein. And immunoglobulin, that's just the fancy medical word for an antibody. So IVIG is basically a super concentrated dose of healthy antibodies taken from the plasma of healthy donors. And this is the part that just blows my mind, the sheer scale of it. A single bag of IVIG isn't from one person. It's made by pooling plasma from 10,000, up to 50,000 healthy people. Just think about that. It's like getting a massive library of immune system knowledge, packed with antibodies that are ready to take on pretty much any bug you could run into. Okay, and this is super, super important to get straight. IVIG is not chemotherapy. That's a really common fear, and it's totally understandable. But chemo is designed to kill cancer cells. IVIG is different. It's what we call a replacement therapy. It's not going after the root cause of the disease itself. Instead, it's all about support. It's giving your immune system the tools, the antibodies, that it just can't make on its own right now.
Okay, so understanding the what is one thing, but what's it actually like to get it? Let's walk through the whole infusion journey step by step, just to take the mystery out of it.
First off, get that cold, scary hospital image out of your head. These infusions are usually done in a pretty comfy outpatient clinic. You'll get on a regular schedule, usually every 3 or 4 weeks, to keep your antibody supply topped up. Each session lasts a few hours, but it really depends on your specific dose. You can really break the whole process down into 3 easy steps. So, step 1, before you go. The number one thing you can do, drink lots of water. Seriously, it makes a huge difference. Step 2, during the infusion. This is your time to chill. The nurses will keep a close eye on you, starting the IV drip nice and slow, but you can just relax, read a book, watch a movie, whatever you want. And step 3, after. It's pretty normal to feel a bit wiped out for a day or so. Just plan to take it easy and keep drinking those fluids. All right, now with any treatment, we've got to talk about the whole picture, right? The good and the not so good. So let's take a balanced look at the benefits, the risks, and the side effects. So, what's the whole point of all this? The big goal is to finally break that miserable cycle of getting sick. By jacking up your antibody levels, IVIG helps stop those frequent infections. The end game? It's pretty simple. Fewer sick days, way less time on antibiotics, and just getting your quality of life back. And here's the really good news, right from the source material. Most people handle this treatment really, really well. And even when side effects do pop up, they're usually pretty mild and don't stick around for long. This chart here breaks it down really nicely. The stuff you're most likely to see are things like a headache, feeling a little wiped out, maybe some chills or achy muscles. A lot of times, just slowing down the infusion or taking some Tylenol beforehand can help.
The key is just to know what to look for, especially those rare but more serious symptoms, and call your doctor right away if you see any of them.
Now, just to put this all in perspective, those really serious reactions, they're very rare. The biggest risks to be aware of are blood clots and kidney problems, and those are more of a concern for older folks or people who already have certain health conditions. And that brings us right back to the most important point. Staying super hydrated and having a slow, careful infusion rate. Those are your two best friends for making sure everything goes as smoothly as possible. Okay, so let's say you've started the therapy. What does life look like long term? Let's hit some of the biggest questions that people have. And this is probably the biggest question on everyone's mind, right? Is this thing going to cure me? And the answer, to be really clear, is no. IVIG isn't a cure. Remember, it's a replacement therapy. It doesn't fix the original reason your body isn't making enough antibodies. It works by giving you a temporary supply, and that's exactly why you need those regular infusions to keep that protective shield topped up.
That's a fantastic question. I mean, if it's just a support therapy, how do you even know if it's working?
Well, they look at it in two main ways. First, and this is the most important one, are you getting sick less? Is it less severe when you do? That's goal number one. At the same time, your doctor will do blood tests to check your IgG levels to make sure you have enough protection in your system. Based on those two things, they can tweak your dose to get it just right for you. And that really brings us to our final thought here. For anyone who's been stuck in that constant loop of being sick, the idea of borrowing strength from tens of thousands of other people, it's so much more than just a medical treatment. It's a real chance to get your life back, to make plans without worrying about the next infection. So the real question isn't just about the science. It's, what would you do with your life if you could finally get it back?